Hello and welcome to the next in our alphabet series of common and routine foot conditions and complaints, and today we are on to G. Now Steve from NK Sports Podiatry has stolen my original G, so I'm changing tack a little bit, but make sure and go and check out their videos, NK Sports Podiatry. They're doing MSK conditions, and today I am doing G for gangrene. Now, thankfully, this isn't actually something that we've seen as a routine problem in the general podiatry. It is more with high-risk clients, and in fact, it's something I've only ever seen once in my podiatric career. And what is gangrene? Well, it is localised death and decomposition of body tissue, and most people have heard of it. It involves a loss of blood supply to the tissues, and the tissues basically die. It can happen anywhere in the body, but it is more common in the toes, the feet, and the fingers and the hands. And usually it is caused by injury, infection, or a long-term medical condition that can affect the blood supply to these areas. Common causes of gangrene would be diabetes, peripheral arterial disease and peripheral vascular disease, atherosclerosis, which is narrowing of the blood vessels and reduced sensation, circulation and clogging of the arteries, Raynaud's, which is a vasospastic condition, frostbite, severe burns and serious injury and trauma, so if you're in a car accident, for example, you'd be more at risk, and weakened immune system through numerous conditions, especially things like chemotherapy, transplants, things like that. The signs to look out for are the signs that you look out for any infection, so redness and swelling, loss of sensation to the area or an intense pain in that area, and sores or blisters that are bleeding or emitting a rather foul-smelling pus from them. Now, the three most common types of gangrene, and the one we see most commonly in podiatry, is the dry gangrene. And thankfully, this normally only affects the digits, and so you may get one of the toes kind of going black and shriveled and not looking very nice. Basically, it's dying, and it does limit itself usually to that body area, thankfully. And it's where the blood flow to that digit has become blocked. There is no blood getting in there, and so it is effectively dying. You can get wet gangrene as well, which usually involves injury to the area and infection. And you do have to be careful with that one. That one can start to spread and you can get more tissue loss, though not necessarily amputation. You can get gas gangrene as well, which is where an infection develops deeper inside the body, and the bacteria that causes that infection release the gas. And again, that is quite a serious condition, does need immediate medical attention, so you do need to get that looked at. You can also get necrotizing fasciitis, which is something a lot of people have heard in the news. It is a very serious bacterial infection, and it spreads very, very quickly through the deep layers of skin and tissue, and that does lead to massive tissue loss and potential amputation of whatever area has that infection, unfortunately. You can also get internal gangrene, which is where the blood supply to some of the organs, usually the appendix, gallbladder, that type of thing, has actually become blocked, and those are starting to die as well. So what is the treatment? Well, you need to remove the dead tissue, and with toes it's quite easy because they will often auto-amputate with dry gangrene, so they will eventually just fall off, which doesn't sound very pleasant, but actually it's the best thing that can happen for them. And you must prevent any infection while it's happening, or treat any underlying infection that may already be there. And you need to treat the underlying cause, so whatever has caused the lack of blood to go to that area, whether that's reopening the blood vessels, angioplasties, that type of thing, you need to be looking at why that blood supply has stopped to that area. And some it's very apparent why, and others you need to investigate a little bit further. So as I say, with the foot, usually not too traumatic in routine podiatry. If you are at high risk, or you know you have poor circulation and problems, and you're getting sores or swelling, redness, anything like that occurring on the foot, please, please, please make sure you go see your podiatrist right away and get it looked at. It's usually nothing, but we do want to avoid these problems occurring.